morning. I am Dr. K.L. Babu, former principal and professor of Government Homeopathic Medical College, Kozhikode, Kerala, and I am the vice president of NAPKIM Kerala chapter. Now, today's chapter is National Health Mission. And before going to this today's lecture, I express my sincere thanks to Colonel Dr. Yashwant Joshi, who prepared this PowerPoint and helped me to start the session. Let us go into the details of National Health Mission. To say about the objectives of the National Health Mission, that is, the first one is to know about the national health programs in India, that is NHP. And the second, understand the relevance of national health policies. The third one, understand the difference between vertical and horizontal programs. So, why we invest in national health policies and why we need to invest in public health? Healthcare spending in India for 2014 is about only 4.7% of its GDP. Of this, government health expenditure is 30%. A majority, that means 62% of healthcare expenditure is household out of pockets. Nearly 55 million people getting impoverished on account of healthcare expenditure. And India ranks a low, that means 175 out of 188 countries in OOP, that is out of pocket expenditure, and 154 that out of 185 countries in terms of public health expenditure out of total current health expenditure in 2015. So, our target is to increase the health expenditure by government percentage of GDP from the existing 1.15% to 2.5% by 2015. That is the national health policy of that is the national health policy of 2017. So, we can look into the health policy 2017. New health policy 2017 emphasizes the proposed health financing, that is to increase health expenditure by government as a percentage of DGP from increase the health expenditure by government as a percentage of GDP from the existing 1.15% to 2.5% by 2025. Increase the state sector health spending to more than 80%. To increase the state sector health spending to more than 8% of their budget by 2020. Decrease in proportion of household facing catastrophic health expenditure from the current levels by 25% by 2025. There are different components in national health programs. One is National Rural Health Mission, that is NRHM. It was launched on 12th April 2005. The aim of the National Rural Health Mission is strengthen the hands of state governments in improving the health care and its delivery by providing technical and financial supports. To bring greater focus on high focus states and rural population, particularly marginalized and vulnerable population. Architectural correction through integration of vertical programs and decentralization of community programs. Another component of the national health policy is National Urban Health Mission, that is NUHM. It was launched on 1st May 2013. Here, the aims of this NUHM are to strengthen the existing primary health care facilities to provide new facilities for the unserved population. 1057 cities and towns are covered by this program. And the third aim is to strengthening the facilities in urban area in terms of infrastructure, equipment and manpower facilities. Let us go through the National Health Mission. That is attainment of universal access to equitable, affordable and quality healthcare services, accountable and responsive to people's needs, with effective intersectorial convergent action to address the wider social determinants of the health. So, let us examine what are the different national health missions. There are different flexible pools are under there in national health mission. That one is National Rural Health Mission and Reproductive and Child Health Program, and another one is National Urban Health Mission, then National Control for non-communicable disease control programs, then communicable disease programs, and to provide strength to the infrastructure and its maintenance. Now, to say about the National Health Mission, two components are there. One is NRHM and another is NUHM. To say about this NRHM, there are again some flexible pools are there. One is this, this reproductive and child health pool, and second one is health system strengthening pool. In the health system strengthening pool, we have other health system strengthening, comprehensive primary health care, and ASHA benefit package including social benefits. ASHA means this accredited social health care activities. Then another component of the NRHM is communicable diseases. Then non-communicable disease pool also come under this NRHM. Then funds are provided for infrastructure maintenance also. The second part of this National Health Mission is NUHM, that is National Urban Health Mission. Here there are two components in this under this National Urban Health Mission. One is health system strengthening. Here there is another part is the comprehensive primary health care system and strengthening of that part. The health system strengthening means it includes components like health system strengthening includes components of national program for communicable diseases, national oral health program, and programs for burns and trauma, national program for pancreatic cancers, and other new initiatives under National Communicable Disease Program. Now, how to achieve the health? We have to look into that by improving host resistance to environmental hazards, by improving environmental safety, by improving health system designed to increase the likelihood, efficiency, and effectiveness of the first two goals. Let us look into the different types of national health programs. One is why we are using these programs for, why national health programs are implemented. One is the aim it is to control the disease burden, because the disease burden is very high, and to prevent the geographical spread. Proven strategies for prevention and control which are available, and to spread it across the country, and to provide adequate infrastructure when and where it is needed. Resources for program implementation which are available, to share it to other states and wherever it is needed. So, some vertical health programs are there. Separate health structures with a strong central management dedicated to the planning, management, implementation of selected interventions. To say about the advantages of this program, they have clear objectives and they are target oriented, and it motivates the staff. Operational planning is focused and it is easy to deliver. It is efficient and it is effectively delivered, and better ability to monitor restricted output. These are the advantages of the vertical health programs. And to say about the disadvantages, no capacity to accommodate extra work in disasters, resources used for specific activities only, and de-skilling of health worker, no focus on overall development, depend on donors for funding, placement of workers after completion of the work, it is a challenging task, long term public motivation and it has to be sustained. but it is not sustained in this health programs. And it may not be cost effective in long run. So, integrated health programs are needed. So, look into the advantages and disadvantages of integrated health programs. To say about the advantages, help national development on a broader perspective, incorporates multinational concept of health, efficient and effective delivery through intersectorial collaboration, has capacity to accommodate extra work, responds to community needs, and it should be cost effective in long run, and it should be a holistic one in its approach to health. To say about the disadvantages, sometimes fail to target priority effectively. Complex programming may lead to more failure. Lack of expertise in integrated program management. These are the different disadvantages. And we can go to the programs for communicable diseases. One is National Vector-Borne Disease Control Program, that is NVBDCP. Revised the National Tuberculosis Control Program, National Leprosy Eradication Program, National AIDS Control Program, Universal Immunization Program, National Guinea Worm Eradication Program, YOS Control Program, Integrated Disease Surveillance Program. These are the different programs which are included in the communicable diseases. And to say about the national nutritional programs, Integrated Child Development Service Scheme, midday meal programs, social nutritional programs, National Nutritional Anemia Prophylaxis Program, National Iodine Deficiency Disorders and Control Program. So, to strengthen different conditions, programs related to system strengthening and welfare of the community, there are National Rural Health Mission, Reproductive and Child Health Program, that is RCH, National Water Supply and Sanitation Program, and more than that there are 20 points program regarding this thing. To say about the national health policies, we have National Health Policy of 2002, National Population Policy of 2000, National AIDS Control and Prevention Policy, National Blood Policy, National Policy for Empowerment of Women 2001, National Charter for Children, National Youth Policy of 2001, National Nutrition Policy. So, look into the National Health Mission components. One is, as we said, that is the National Rural Health Mission, RCH pool. The RCH pool, it is flexible, it is a flexi pool. One, it is RMNCH, that is reproductive, maternal, neonatal, child and adolescent health. There is immunization program, routine immunization and pulse polio immunization. NIDDCP, that is National Iodine Deficiency Disorder Control Program. Health system strengthening, the ASHAs, that is ASHAs means accredited social health workers activities. Then human resource including Ayush and mobile units, referral transport systems, free drugs, free diagnostic techniques, biomedical equipment and management, quality assurance and Kayakalp, all are coming under the infrastructure thing. So, we have to go through the National Urban Health Mission, the second one, to strengthen the existing primary healthcare facilities and to provide new facilities for unserved population in urban areas and urban poor also, poor people also. Major components of planning are mapping, planning, program management, training and human resources, then other community programs. In the National Health Mission, there are different components. One is Communicable Disease Program, that is RNTCP. That is Revised National Tuberculosis Control Program. Here, to strengthen that thing, the funds for civil works are allotted, laboratory materials for testing, it is supplied, and another one is National Vector-Borne Disease Control Program. In it includes the malaria, dengue, acute encephalitis syndrome, etc. Then National Leprosy Eradication Program. For that, the National Health Mission provides human resource, mobility support and other support to control the program. Then IDSP, Integrated Disease Surveillance Program. For that also human resource and mobility supports are provided. Then come this NVHCP, National Viral Hepatitis Control Program. Here the drugs are also provided for this program. Then coming to the non-communicable disease pool, National Program for Prevention and Control of Cancer and Diabetes, Cardiovascular Disease and Stroke, that is NPCDCS. Then another program is National Program for Control of Blindness, National Mental Health Program, National Tobacco Control Program, National Program for Health Care of Elderly, and funds are provided for infrastructure maintenance also to meet the salary requirement of auxiliary nurses, midwives and lady health visitors, etc. Let us examine the progress of this financial progress of National Health Mission. You know, in central government allotted 2,22,114 crores to strengthen the health system under NHM. The states have contributed about 64,647 crore rupees towards the state share under the National Health Mission in the ratio 60-40. Total fund for the National Health Mission is 2,86,761 crores, which was made available till 2018-19. Now, why we need further allocation? Because you know that we have to enhance the allocation to strengthening the sub-centers strengthening the sub-centers as health and wellness centers and to provide comprehensive primary care. Comprehensive primary health centers including screening of common non-communicable diseases such as hypertension, diabetes, common cancers, and to increase the number of primary health centers and community health centers as per the Indian primary health standard norms. Increasing the number of primary health centers and community health centers as per the Indian public health standard norms and upscaling the existing initiative, that is to strengthening the facilities to Indian public health system. And again to upscaling the free drugs and to diagnostic schemes. Just look into the allocation for 2019-20 under National Health Mission. A very good share it is there for this health system strengthening under NRHM, that is 43%, and 90% is allocated for the RCH flexible pool, reproductive and child health pool. National Urban Health Mission got nearly 4%, and flexible pool for communicable disease have 7% allocation. Like that we can see that a lot of funds are allotted during 2019 and 20 under National Health Mission. Then activity wise approvals under NRHM and reproductive and child health flexible pool in 2018 and 19. You know, a major chunk was given to maternal health, including Janani Suraksha Yojana and Janani Shishu Suraksha Kriya. About 40% of the allocation was there for this maternal health. Then for the program for NRHM, 28%, and for family planning it is 12%, training and other program thing 6%. Like that you can see this different allocation in 2018 and 19. See, to say about this activity wise approvals under the health system strengthening pool under 2018-19, you know, that for the human resources 9,471.33 crores, that means 0.62% was spent on this program. And to procure this medicines and other materials 5,27,871.46 crores. That means the major chunk of that 33.54% of the allocation was there for the procurement of medicines and other materials. And to strengthen the ASHA workers, 2,48,867.42%, 42 crores, that is 16.29% of the total allocation was used for ASHA workers and its strengthening. Then for hospital strengthening, 12.57%, that is 1,92,092.83 crores. National Ambulance Service, 1,11,052.46, that is 7.27% of the allocation was used for National Ambulance Service. Like that, different components and categories we can see, different allocations were given. National Mobile Medical Vans, then the drug warehousing, maintenance of Ayush. It is also a major component of this National Health Mission, and for that 229.22 crores rupees, that means 0.02 percentage was allocated. So, how to plan this NHM? So, we have to incorporate different components in this national health planning process. One is PIP, performance implementation program, guidelines and resource envelopes. This has to be there based on state priorities and PIP guidelines. And there are different divisions that we have to examine one by one. Then it will be communicated to states. The state has to submit the draft of the PIP. States and union territories to submit revised program implementation. The states and union territories has to submit the revised planning for program implementation based on discussions, and after that only these funds are allocated. Then before that, this consolidated components received from all divisions has to be collected. And finally, revised proposal accepted only on sections where additional information has been sought. This PIPs appraised in national policy meetings as per the resource envelope of states and ROPs issued accordingly. See, we can see that it's a bottom up approach for planning. That everything is coming from the root level. Grama Panchayat has to chalk out the plans, and they have to incorporate the community health centers and PSC, the primary health centers, for this thing, and it will be communicated to the block level. This block will again this block will communicate everything to the district level, and finally the state will plan the thing and it will send to the national level. So, this is the program implementation, and these are the different financial implications. The total resource envelope, we can see that there is a central share, state share, and the unspent balance of the previous year. So, we can see that how the fund it is flowing. Fund flow mechanism under National Health Mission. Government of India provide fund to the state treasury, from there to the state health society, and it may be going to district hospital for different projects, and that the state hospitals, they also implement certain programs, and implementing agency in the district level, then community level health centers, then health sub centers, primary health centers, village health nutrition and sanitation program, all together use and follow the guidelines of the National Health Mission. Release under National Health Mission, that there are two types of grants now. One is cash in grant, other is kind grant. Funds are released in three parts. One is general, that is for scheduled caste subplan, scheduled tribe subplan. All releases are made on basis of census population of 2011. Further breakup release in revenue and creation of capital assets. Creation of capital assets involved in health system strengthening, just like NUHM, that is National Urban Health Mission, and National Communicable Disease Program. Basically, for civil construction involved are used. Creation of capital assets involved in health system strengthening, National Urban Health Mission and National Communicable Disease Program, Prevention Program, and all are coming under this scheme. So, the funds are provided for all these things. Then there are certain criteria for release of funds. First release of 75% of the 80% of this thing. So, no shortfall under state matching contribution. The first criteria. The second criteria, provisional of utilization certificate of the last financial year. Regular financial reporting and physical reporting in financial management report and that progress report. Considering the unspent balance, transfer of fund from treasury to state health sector. Financial release of balance, that means in 25% of 80% of balance, same as above. Receipt of statutory audit report and audit utilization certificate is necessary for all these things. Ensure the increase of state health budget by 10% over last year. So, 20% of funds under flexi pools have been earmarked for towards utilization of states and union territories. Release under national, to say about, to finalize, complete it now, that critical observations we have to look into. One is ensure compliance of GFR rules of 2017, General Finance Rules of 2017 for release of funds, procurement of services and goods, etc. State Finance Rule for procurement of services, goods may be followed. Temporary loans can be taken and to be returned to original pool on receiving the funds. Permanent diversion is prohibited. Regular monitoring of advances with age wise, it is analyzed. Ensure JSY and ASHA payments through direct. Ensure submission of consolidated FMR with the physical achievements, financial management report with the physical achievements on monthly basis, covering all programs of National Health Mission and these are about the a short look into the National Health Mission policies and its implementation. Thank you.